Hey everyone, I'm Sheila. Welcome back to The Truth About Death and Dying. I'm very happy to welcome back my good friend Alicia McPhail. Hi Alicia.
Hi, Sheila.
Welcome back. I wanted to, before we get started, I wanted to just take a second to give the two definitions for dementia and Alzheimer's because it's confusing a little bit because people use them one and the same sometimes. And so dementia is a general term for a group of symptoms that cause a decline in cognitive abilities, such as memory, thinking, problem solving, and language. It is not a specific disease, but a collection of symptoms that can be caused by various underlying conditions. Alzheimer's disease, on the other hand, is a specific type of dementia that is the most common cause of cognitive decline. It's a neurodegenerative disease that damages brain cells and causes progressive memory loss, confusion, and other cognitive problems. So those were the two, just to kind of give you a little clarity for those who may not know. And the other term that we used was sundowning when we were talking about your mom. And it's either sundowning or sundowner's syndrome. So if you've heard that but didn't really understand what it meant, it's a phenomenon where people with dementia or Alzheimer's disease experience worsening symptoms in the late afternoon or early evening evening hours. So, excuse me. I just wanted to clarify that for those who,
Yeah.
weren't entirely sure about what those both meant. So, for those that maybe are just joining us today and they haven't watched the previous podcast with you and your story and whatever, can you just, kind of give a little synopsis of, why you and I are here talking today, and then we'll go from there.
Yeah. So just briefly, I think what we did was I just recapped the dynamic of my mom and I's relationship in the early years and then kind of progressed because, looking back at it, I kind of felt a little bit bad after, maybe I revealed too much, but it absolutely played part into my story because when symptoms started arising, and then the way that I dealt with symptoms and was trying to determine, are these even symptoms or what is going on? It did play a part into the behavior as to, if this was related to things I had seen growing up, or is this something new? So I think we kind of just started with a little bit of the dynamic between my mom and I, her raising a single child and the struggles that she had and how she kind of self-medicated sometimes with alcohol, and then the struggles that she had. And then as she got more settled and more comfortable in life, just the decline of the memory. And then just from there, I think we kind of paused it.
Yeah.
That was where we had enough for. So the synopsis was really just more of the backstory as to how did we get to the place where, oh my gosh, this is a reality.
Was she diagnosed with dementia or Alzheimer's disease?
Early onset Alzheimer's.
Okay, all right.
Yeah.
Because I'm not sure that we even nailed that down before too. So.
Frontal lobal, or front. I don't know.
Okay.
Front. It's not front lobal, but it's like frontal lobar.
Okay.
It's all like right here.
Okay.
Yeah, it's all in the front.
So, I think the last episode where we kind of left off was that your mother. You had taken your mother because your stepfather, Sheldon, was in Massachusetts having major surgery, correct?
Yes.
And your mom, you had to take your mom to the doctors because you realized
I didn't know what was happening.
That something serious is going on with your mom, and you needed to investigate that. So the last we left, she was at Acadia in Bangor.
She was seeing the neuro surgeon, the head of that department, Dr. Singer, who was wonderful, by the way. He's still there. And again, I knew that Sheldon had been taking my mom for appointments, but she always had 1,000 medical appointments,
right?
For back and for this and for that and for. So I was never asked into these appointments. I was never a part of anything that was going on with this side of my mom's medical issues. So all I knew was the name Dr. Singer. So I looked it up. I took her. because I thought she was having some type of mental
You
crisis,
said like maybe a
honestly.
mental breakdown or something.
Yeah,
Yeah.
yeah. I thought maybe with Sheldon being in the hospital, that, and she relied so heavily on him, and he was such a, drastic part of her life. I mean, they were like this. They never were apart. I didn't know what was happening, but
Right. So you
and
got
like
so you got to Acadia, and they basically
and
they're like, we're going to keep her. We're not
uh,
sending her because you were unable at that point. You couldn't care for her at home yourself.
gosh, no,
Yeah, and so
no.
so she's
And I mean, I think what's important here too is that I was the first one that didn't mask the
right,
symptoms.
right,
I was not her caregiver, and
right,
so that's where this is important. As
right.
a caregiver, a husband, a wife, somebody, you don't want to take that ride home where when she's not, and he didn't want Sheldon, God love him, he didn't want to be yelled and screamed at, and why did you say that? You knew I was perfectly fine, so he was the driver, and
Yeah,
he sat there through the appointments, and he let mom present very well. So this was the first time in me in this environment, just looking at her behavior. I think I mentioned in that appointment, she said hello to everybody that we walked by. Alicia, I
yeah.
have to use the restroom. And I'd be like, okay. And she couldn't go there on her own. And I thought that was odd. So I walked her to it, and she said hello to everybody in the waiting room, like she had known them for years. And so that was odd. And
She said she was a
the
writer. She was writing a
yep,
book,
yes.
which was
What are
not
your
told.
hobbies? I'm
Yeah,
writing.
yeah,
She mentioned my father a lot.
yeah.
Um, and they had been divorced, gosh, since
Long
late
time.
70s.
Yeah.
Yeah, early
Um,
80s.
and
So
and I
I
imagine,
called it out. Yeah.
yeah, and so then the truth was kind of revealed, and I can imagine, and I'm sorry we didn't talk about it at the time when you were telling the story, but when you were leaving Acadia and your mom's going in a different direction and you're going, and she's like, no, 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 I'm going to go with, I mean, that must have been so heartbreaking for you to be
It
like,
was the
uh,
most difficult thing I had to do, probably in my entire life.
yeah,
Yeah.
I can,
I couldn't walk past, she had, I don't want to call them guards, whatever,
orderlies,
whatever they are, that
orderlies, I
orderlies.
don't know, yeah,
They were walking us from the medical appointment that was down to the right. We're now walking, so you go into Acadia, and the right is like the medical offices, the left past the entrance is like past the locked double doors. And so we're walking, and she's thinking we're going out through the entrance, and they're kind of nudging her along to go straight. And she couldn't comprehend what was happening, even though we did call Sheldon while we were there. I mean, and they tried to explain it to her, and she did agree.
yeah,
Okay. And they said, Jeri, it's just to see if there's some medications that maybe we need to. Even though she agreed, she was still waving goodbye to them. We'll see you
because she's
next
going to go with
week.
you, yeah,
And then she's like, oh, no, no, my daughter's right there. I'm
uh
going with her. And I had to just,
God,
and there was no cordial goodbye. There was no, oh, okay, I understand now. Well, I'll see you, Alicia. It became very tearful, and it became very, like you're leaving your child
yeah,
at daycare
that's
for
what I
the
was
first time.
thinking, like,
And yeah, it was really difficult.
I'm so sorry you had to go through that,
Probably not as difficult as the first time I went to visit and I actually saw what was behind those closed doors,
yeah,
because they put her in a 48-hour lockdown, because that's all they do. For 48 hours, they observe. And so you're there. They don't just take you right up to the fifth floor. There is no Alzheimer's floor anyway. I think I mentioned that.
yeah,
There's just the floors of the people that are certifiably, they're unwell
yeah,
mentally, whether it be drug induced, whether it be schizophrenic, whether it be mental retardation. I don't know what you call it, but before, you don't just get admitted right up there. You have to go into that 48-hour. And the things that I saw, God, it was like a prison holding cell room that she was in, with a peephole and bright lights in that little room, with a cot. And, even walking to her room, it was just so prison like, and I saw some very disturbing people, of other people who, suicide watch is what it was basically. But whether it's suicide or whether it's you're there for observation to determine whether you can go to prison, that's where you go. And so that's where she had to be for the 48 hours. And of course, she wouldn't eat. Anyway,
Right.
um, so that kind of started that decline. I'd go
Yeah.
and visit, and she wouldn't eat the trays that were put in front of her. So it was 48 hours there where she met with the first round of mental health people, and then they decided, yes, it's warranted keeping her. And they put her upstairs for about 6 weeks.
And it was determined that she couldn't leave until she had somewhere safe to go. Is that right? And
Yeah,
Sheldon, in the meantime, your stepfather is
still in Boston.
still in Boston.
Yeah,
So he gets back. How? So when so he finally gets back, he gets her home. You said he was like, "No, I'm not putting her ever again in a
correct. Well,
mental
we had several
facility."
meetings, before Sheldon and before she even left Acadia, because they basically had to ground out. They took her off everything that she was on because they admitted she's declined, like something, and I don't know if she really declined or if it was the first time they actually saw a true picture,
Of who she was or what was going
and
on.
then actually got to spend time with her. Other than your 30-minute, do you know who the president is? Do you know what
Right.
date it is? Do you know what time it is? Do you know who this person is beside you? Other than the checklist. Okay, well, I guess we'll just keep you on the Aerosat or whatever the prescription was that she was on to try to. She was on so many prescriptions because at that point, if you don't start treatment early for these dementia and Alzheimer's, there are medications you can take, but the longer you delay them, the less effective they are.
That makes sense. Yeah.
So, and the clinical trials, same. So, because she was in such, or he was, or I don't know how that all went because I wasn't a part of those conversations. It was all hidden from me.
Right.
There wasn't a whole lot of help available other than treating the symptoms, which included mood stabilizers, sedatives, Valiums, Zolofts, antipsychotics, something to help her sleep, like keeping her comfortable, keeping her detained, plus the back medication for her back spasms, the muscle relaxers for that. Like she was on such a regimen, antidepressants that she was probably been on for 40 years. Like they basically ground zeroed her up on that fifth floor, whatever floor it was.
Mm-hmm.
I say fifth floor because it sounds good. It might not even be fifth floors. It might be 3 floors. I don't know.
Doesn't matter.
You're right. But all I know is it always felt like a very long elevator ride. It
Yeah, I
always
bet.
felt like I was going to the top of when I would leave. But anyway, I digress. So they took her off everything and had to wean her off everything. And that was a really long process. There was a couple times I got phone calls where she would just, your mother fainted because her blood pressure, like she literally fell out onto the floor. And of course, she wasn't eating, so she was so brittle and frail. And she wasn't eating because they didn't know how to address her eating issues because it's not an Alzheimer's unit. They just think,
Right.
oh, well, she's mental. She'll eat when she's hungry,
Right.
and that's not the worker's fault. They're not trained to handle this patient any differently than your bunkmate who's just detoxing off drugs and wants to kill themselves, right? So you all get the same tray of food. They don't have the resources and they don't have the staff to sit there and try to sit with my
Coax,
mom
coax them to
and
eat.
be,
Yeah.
and you only get a spoon. You don't get forks. You don't get knives because they could be weapons. But here's a chicken breast with a spoon and a salad, and so my mom would be like, I don't like chicken. I don't like salad. And unless I was there at eating time and say, Mom, you do. Yeah, you do. Just try a little bit. I don't want to. Like, everything became, all of a sudden, she didn't like anything. So the lack of food, she would drink in Shores, and that's about all they could get her to eat. So
Mm-hmm.
the lack of food and then the severe shock of that the body goes through when you completely get off all
Take
these
all those
medications
meds. Yeah.
that are all, she'd fall and faint, pass out on the floor because her blood pressure would drop so rapidly. Um, so she was where she needed to be, but several times we had big meetings, come to Jesus meetings with about, round table meetings with Dr. Singer, and then the head of does Dr. Singer stayed downstairs? Once you go upstairs, you kind of get assigned somebody else.
Okay.
But he was her treating physician. So there'd be so many people, the staff nurse that had her the most. I'm sure you went through this too with your dad. Like there was so many different people that you'd have these conversations with, but they kept telling Sheldon, um, you know, we're worried about her safety. We're worried about your safety. You just came back from having major, you know, you might want to think about, like, this isn't going to get any better. So what
Right.
you see now, other than continuing to treat symptoms, the Alzheimer's medication does not fix it. All it does is try to prevent it from getting any worse any faster, if that
Okay.
makes sense.
Yep.
But we're already like there.
Right.
So, and he refused. He just, no, as long as she knows who I am, I'm not
Yeah.
putting her in her place. So he had ample time, he had
Yeah.
ample time to call DHHS, or, you know, and they kept giving him phone numbers. They gave him the paperwork. Just fill this form out and we'll file it for you. And again, I wasn't really part of that,
Right.
but I'd say, Sheldon, did you drop the form, all that paperwork off, you know, at the, no, I haven't had a chance. You know, I just
And
don't know.
meanwhile you're in South Carolina.
No, no, I hadn't moved yet.
Oh, you
I was
hadn't
still
moved yet.
here.
This is, oh, you were still,
Mm-mm.
oh, okay.
Oh, I was still home. We
Oh,
were
okay.
still visiting her 3 times a day.
Oh,
I
okay.
mean, yep, yep.
So when she was finally released to go home
Home, yep,
to Sheldon's home,
yep.
their home,
She was a
um,
little better, yeah.
and did you have a hospice team come in at that point?
No, no, because she wasn't deathly by any means. I mean, she
And,
wasn't, they weren't like, this is the end.
but did he have any kind of help, or was it just on him?
No, on
On
him.
you? Yeah. How
Not
long?
even on me. Not even on
On him.
me.
On
I mean,
him.
I still had 3 kids. All I
Right.
could do was take those crazy phone calls. Would you please, he'd text me, would you please call your mother? I'd be like, I just talked to her. Could you please call her? Or, um, you know, or she'd call me, you know, she'd call me and beg me to come pick her up so she could go home. And she was home,
She was
you know.
home. Yeah.
So other than that kind of thing, I mean,
He took her on.
she
Wow.
might've, I think she lost like 15 pounds. But she made
I
up
can't
for
even
it.
imagine because your mother was so tiny to begin with.
Right.
How that even.
But you
Well,
figure, yeah, she was a little underweight, but physically there was no reason, like, as long as he could take care of her, there was no reason for social services or anybody
to come in and
to
help.
step in, and that they can't, you know. And I was on the fence too, because she wasn't completely, she definitely had her moments when she was in there, but again, they did keep her pretty, you know. She had to line up for her little pill cup like all the other crazies. um you know, and once they got all the medicines regulated on what she really needed,
Mm-hmm.
half that shit could go. And I
Yep.
told him that half that shit can go. um you know, she was in a much better place once she got home.
Good.
So they think that what triggered such a fast decline was the change of Sheldon being gone
Oh.
and my uncle coming in, and she couldn't verbalize that
And
and handle it
disrupting.
like
Yeah.
a
And
normal.
disrupting. Yeah.
It was such a disruption, even though she knew it was coming, that the brain is in such a disarray. It doesn't understand at all. And instead of handling it like I'm gonna, you know, I'm gonna talk through this, or I'm gonna cope, or I'm gonna go for a walk, it's just a mass of
Yeah.
like. So once he was home, she was much better, and she went home fine. And like I said, we tried to do some things. We put a few different deadbolts on the front door. But he continued to, but see, now I was involved. So I did know a little bit more about the situation. That's when I found out, you know, he showered her every day. They showered together. He washed and dried her hair. He'd put it in a ponytail for her. He'd paint her fingernails. So
Which
there
is
was,
really sweet. I
he,
mean, that's the
it's
kind of person
so sweet.
everyone
Oh
needs to
my
have in their life,
God.
right? I mean,
And, oh, right. I mean, like
you
I
have a
said,
partner.
as
I
far
have a
as,
partner that will do that for you. That's
oh my gosh, and the things that that man, and the meanness that he endured. I mean, it's funny, but it was not funny. Nobody else. And God, I couldn't have done it.
yeah.
I could not have taken her in, and I told him that 1,000 times. And if it meant, if anything were to happen to you, Sheldon, and I said this so many times, if any, you cannot die. You have to take care
Yeah.
of yourself. I mean,
Yeah.
he was like a father to me. So if I said,
Yeah.
Sheldon, you're looking kind of pale. Oh, I'm fine. I'm like, you cannot die,
Yeah.
because I can't take her into my home
And being a
with,
caregiver, especially like that, 24/7 like that, that's a
oh
toll.
yeah,
That's a toll. I can't. I mean,
yeah,
I had help with my dad.
right,
My brothers would come through, and my sister-in-law, and other friends of my dad would
Right.
come in and give me respite, but I can't imagine doing that 24/7 without a break. That just because
Right.
you
And
will
she'd
cry.
fight you on everything.
Yeah,
You'd say, you got to put on your, you got to put on your, I remember one time before I took her to that appointment, I helped her get ready for bed one night because my uncle was just like, I got to get out of here. I got to go, take the car and go. And I tried to get her ready for bed, and she refused to put on her pajamas. She refused to take off her pants. So I had to, I mean, you pick your battles. Nobody sat down. There was no resources or social worker or anyone to say, this is how you handle these kind of
right.
symptoms. So I'd fight and I'd be like, no, mom, and you're it's time for bed. I know you don't want to sleep in your jeans. Like it would be this. And then finally I'd give up like you would with your child.
Yeah,
I
like
started
come on,
treating her
sleep in
like
your
I would
jeans.
my, I'd
Sleep in
say,
your
you know
jeans.
what? Well, put your pajamas on over your pants then. Well, that's fine. And we'd do that.
That was
I
okay.
mean, but
Yeah,
she'd have 14 layers on to go to sleep because,
yeah,
but I mean, he dealt with that on
all
the,
the time.
all the time. I mean, I can remember leaving being like, ugh, I'm either exhausted or I'm crying or I'm like, how hard is it to take off your pants? Like,
Yeah,
it's not like she's drooling. Like, you expect someone who is that acting like such a child, you expect them to be so far gone,
yeah,
right? And so far, like, out of it. But they're not. They can talk like you and I are right now, but just so obstinate about
yeah,
so many little things. And it, it, it is just, it's a torment
yeah.
like that. So,
How long once your mom came home? How long was it before she died?
about, I'm going to say 2 years.
Okay, so and so for
Yep.
that whole time, Sheldon took care of her.
Maybe a year. Hold on.
And when did you move during that time?
Yeah. I'm going to say not even 2 years. I'm going to say it was a year. Yeah, it was a year. Yeah, he did okay. I think he did okay. And when you said, I can't imagine because your mom was so little. My mom packed it on a little bit because, so part of this frontal lobe thing is, all she'd eat was sugar. So
It
my
tastes good
mom,
because it tastes good.
she had an addiction to chocolate. And I think I don't know if I told you or someone else, like my entire life, I think I can remember my mom indulging and eating like half a Kit Kat,
I think you
maybe 3 times.
I think you said that on one of the
Yeah.
previous podcasts.
She
That yeah,
never was a snacker. She didn't eat chips. She didn't eat, but chocolate, never saw her just haul into a Snickers or eat a hand. But Reese's peanut butter, those miniature,
yeah.
I mean, I'd bring a bag every time I went to Acadia to visit, a bag of Reese's miniatures peanut butter cups just because I wanted to have the
Something.
nutrients, the
Oh yeah.
sugar. So she packed it on a little bit.
Did she?
She packed it on.
Yeah.
Yeah. I mean, she wasn't fat, but she definitely wasn't frail.
Well, that's
She definitely was
yeah.
healthy.
Well, that's
Yeah.
good. Yeah.
Yeah. She wore the same clothes every day, maybe
Wow.
with the exception of two different shirts that he'd wash. But so then I would say 2000 and it was 2017, Sheila, that there was a decline with things, and that's because honest to God, she got a urinary tract infection,
And that's very common.
and
That's very
that's
common.
exactly what killed my mother, to be honest with you, because she, and she'd have accidents anyway. I think I mentioned, like, throughout this time after she came home from Acadia, and they had a very good life too. I don't want to make it sound like all doom and gloom. They'd stop over a couple times a week. They'd go out in a drive in Sheldon's little red MG convertible midget, and she loved that. She loved that car. She
Yeah.
loved having the top down. He'd take her for rides. Um, they didn't. They got takeout all the time. That's pretty much, that was their life. Um, they'd come. She'd come see the kids. She loved coming and visiting the kids. They wouldn't stay very long. She'd get real antsy.
Yeah.
But she loved her dog. I got her a guinea pig. She loved the guinea pig. She got a big kick out of watching that guinea pig. She did try to feed it a dish. She did try to feed it chips. She was feeding it chips one day through the cage. That was kind of funny.
Did it like
But
it?
so that
Did he like the chips?
I don't think so. I don't know. I don't think it was eating it, but
Yeah.
it was trying to. But overall, it wasn't, she was happy. There were some times, again, the sundowning, or he would find her in the middle of the night, on the bathroom floor, confused, not knowing where she was. There'd be accidents, things like that. But for the most part, he was washing the bed every night or the sheets every morning. He was, during that year, they had a good life, I'm
Well,
going to
that's
say.
good.
And he didn't mind taking care of her at all. And he never never complained about it. There weren't fighting there. She didn't call me crying. She was happy. And it was really nice. And I think her medication, she continued to see Dr. Singer like once every 3 weeks. Things were fine until she got the urinary tract infection. And because he didn't understand, he's a guy, and she all the time was kind of having bathroom issues sometimes, and she would be so mortified that I was even talking about this. But it wasn't, again, until I went for a car ride with them, and I swear to God, through Hamden, if you've ever driven to Hamden, all through Hamden, there's all these little gas stations.
Mm-hmm.
And she'd be like, Sheldon, we need to stop at the gas station. And he'd be like, for what, dear? I just need to use the bathroom. But then, and I'd go in with her, make sure she didn't like walk behind the register, because there were some funny things. I mean, we go out to eat, Sheila, at Anglers, and she'd walk right behind the kitchen, right, walk right back there and talk to people.
Ah,
Yeah,
why not?
hi, hello, walk right between the kitchen doors, like
I love it.
happy little thing. But anyway,
Yeah.
but then we'd have to stop again, and I'd be like, Mama, I'm going to go in the bathroom with you, like in the actual stall, which was very uncomfortable for my mom and I, because we did not have that kind
Right.
of like, we didn't change in front of each other. We didn't come in the bathroom like when each other were showering growing up. Like, my mom was a very private person. So I'd go in and, she'd sit down and she'd be like, well, turn around. So I'd, look, and she'd be like, I say, what are you doing? Well, I don't have to go. And I was like, Mom, you just sat down. Here, let me turn on the water. I'd like turn on the
Yeah.
water. Alicia, if I don't have to go, I don't have to go. And I'm like, okay. I mean, I can't force her.
Right.
So she'd stand right up. Like, she'd literally sit down, not even give it a second. And she'd stand right up, and out we'd go to the car. Next gas station, Sheldon.
Go again.
And so we didn't know if that's urinary tract infection, or he didn't know. It is it her brain not telling her,
Right. Is the
or
message getting like mixed
yes.
up somewhere? Yeah. But I think
And
that's
so
a
that's
very
what it
common.
was.
That's like a big
Mm-hmm.
problem. Is the urinary tract
Yeah.
with folks that are older, probably have dementia and stuff, and I don't, yeah, I don't know. It's crazy that
Well,
that's
because they can't communicate
yeah,
like, hey, I'm not just doing this to be a pain. I'm not doing this to be aggravated. Like, I can't pee.
right.
They, in her mind, she's like, if I can, I can't. Like,
Right.
don't force.
Don't
She might not even remembered we've stopped every three
right. And
miles.
she doesn't
Like, I
remember
was,
stopping all those times, probably.
and I was getting irritated because I was like, Sheldon, you need to just tell her no. And that's what I whispered. I was like, you need to tell her no. Because I was in the back seat.
Yeah.
And I'm like, because again, there's no social worker, there's no counselor
To
to
tell you,
help you
to guide
through
you.
this
Yeah.
stuff. Like, if this is an issue, call the doctor. Dr. Singer wasn't saying, look out for these things.
Right. Which
She
is
might have a
unfortunate that they
problem.
didn't give you any kind of.
Well, I don't know that there is somebody like that.
Well,
I don't know if
I
there's
feel like there is, but I don't know. I
like
wanted
an
to,
advocate or something.
yeah. Um, I have a few questions for you that I'd like to, ask you. And one of them was, what were some of the hardest things that you had to deal with? And maybe we've already talked about it, but maybe if you had anything
Mm-hmm.
else specific you were thinking of, in regards to your mother's condition and her situation, either at the time or since she died. Like what would have been some
Yeah.
of the hardest things that you've had to deal with?
Oh Lord, now you're gonna make me tear up. The hardest part for me was losing my mom, but still having my mom, because I was also, personally at that time going through my own, I was going through kind of a dramatic breakup, and I just wanted my mom. And so here I am going to Acadia to visit her. But damn, I just wanted my mom. I wanted to be consoled. I wanted to have somebody, but you still have your mom because she's right there in front of you, but they're gone.
But she's not. Yeah.
And other than take my hand and just say, I love you, honey. I'm so proud of you. I'd be like, I know, mom. And you don't want to, that's the other thing, you don't want to sit there and do this
Yeah.
in front of somebody that has no idea.
Why are you
Why are you
crying,
sad?
dear?
Yes.
What's wrong? Yeah.
What's the matter? I'm going
Oh,
to be fine, and tap my hand. And so it's just the constant game face that you have to have on. And I wish it had, I wish we'd been in a better place where I could have grieved in front of her and mourned that. But I don't even know if that's something that somebody with that condition could even, I guess it's so unique.
yeah.
I guess it depends on the individual. Maybe
Right.
some are more aware of what's happening,
Right.
like, and the effect it's having. But in my mom's case, by the time that, she was the word she was, that there wasn't any point in crying in front of her. Like, that would have just made her sad and she
Yeah.
wouldn't have understood. So I really felt like, other than the times that I would cry to Sheldon, which wasn't very often because he was always with her, I really had no one,
That's
nobody to
that's
just say, this is crazy.
yeah.
This is absolutely, especially towards, the end. And so when she got that urinary tract infection, and I know you have more questions, but he took her to St. Joe's. Like, it was a physical thing. It wasn't a mental thing. Like,
Right.
I think she had fainted, or she was feeling sick, or she was having pain. Like, it had gotten to the point where now, as a man, he's noticing, like, physical symptoms.
Right.
And her, I've never had one, but I guess your pH or the chemicals or the poisons that get in your body can do havoc. Like, when you have an untreated urinary tract infection.
I've had one in my life, and I was
Yeah.
probably in my maybe 20s. It's horrible, and
But
it really
yeah,
hurts, and then it will be like, but nothing will come out, like you can
right.
just a little tiny bit, but it is so painful.
But if you, after this, if you Google it, an untreated urinary tract infections presents as symptoms of psychosis
Oh, I can understand that.
because
If it
of
was untreated, it would drive me
because of
crazy.
the bacteria. The
Oh, okay.
bacteria backs up into your bloodstream. So
Okay.
even the most sane person, right? So maybe that was it. Like, maybe she was having a really bad spell, like, off the wall. But anyway, I came down to South Carolina to see my youngest off to college.
Mm-hmm.
Everything was like fine. I just came down for a couple weeks. And that's when he called and said, your mom's in the hospital. And I was like, oh my gosh, what happened? And he said, she might have fallen. I don't know what it was, but anyway, she had an untreated urinary tract infection, so they were keeping her to get her everything back regulated. Um, and because of that, that's how, that's when the things got really, really bad.
Did she die in the hospital?
No, she died. Well, the only reason that she went to that rehab
Mm-hmm.
that we talked about was because she was so weak from that urinary tract infection.
Okay.
She still needed to walk a little bit with a walker because she wasn't really eating now at that point because she was
Mm-hmm.
sick, not feeling well, dropped some weight. So she was in there about a week and a half. And they felt like it was best for her to go to a rehab facility just to get her well,
Mm-hmm.
strong enough to be able to, well, how'd they say, until she can walk out of here, I guess is how
Well,
the,
right.
right. It had
Not
nothing to
well.
do with here. It
Right.
had nothing to do with here. Until she can walk on her own, like, out to the car.
Okay.
I don't know if they force you or whatever, but that's where she went to that place on Main Ave.
Oh, that.
That's where she died
Ugh.
of Alzheimer's, of right there.
Were
Because,
you were you here? Were you here with her when she died?
uh, so yeah, so she was there. And at that point I decided, because I thought she just was coming home and everything was going to be fine. So I extended my vacation here. I had been laid off from my job. So, I was spending a few more weeks here and the kids were with me. And then, the phone calls with Sheldon, she wasn't doing so great at that rehab, um, understaffed, not familiar. She was on a basic lockdown ward. Um, Again, it wasn't necessarily an Alzheimer's floor.
Mm-hmm.
It's just, again, kind of like an Acadia,
Right. Just
but everybody in it is
yeah.
like 70 plus, 70, 80. They don't, a lot of them didn't even have family. A lot of young staff, CNAs are in
Right.
care of your mom, and you're different. You never see the same nurse twice. Hard to go in and
Yeah.
talk with anybody in charge. So that's where she passed there. And I got the phone call from Sheldon, like, I think it's probably time that your mom's not doing well. So I think you should come home. So I flew home, left the kids here. I flew home and I stayed for 2 weeks. And that was probably this kind of long story. This leads back to your conversation. What was the hardest part?
Yeah.
Besides having my mom physically, not having my mom physically, those 2 weeks were the most, they were glimmers of happy moments, but those were kind of like something out of a Stephen King movie for me, with my mom there. And I said my goodbye to her. She would not die with me there. I so wanted her to. I mean, because at that point, hospice had been called, but
Mm-hmm.
I had never seen them. They'd never come in. They had never been a support to me. I met with one lady one time who asked Sheldon to make an appointment with me, who met us there, took us in a back room, and it was me, Sheldon, and that lady. And I was so confused as why hospice was involved. Like, just make her eat, put in a feeding tube, because that was the whole thing. She wasn't eating.
Right.
So, and she was getting unruly because she's undergoing a huge change. See,
Right.
it's that whole. So they were drugging her, and they were putting on our really strong medications that were having horrible effects. They were stiffening her muscles and making her and her grips on beds. She couldn't bend her fingers, and
Wow.
it was like Zelda in Pet Cemetery. I'd go in and she'd be and I demand to speak to somebody. So now hospice, this lady wants to meet with me, and I just couldn't understand why you weren't doing more to. I guess I didn't understand either what the role of hospice was,
Right.
but
Yeah.
I thought hospice was to try to
Keep
make
them
things more
comfortable.
comfortable.
Yeah.
And I was like, does she look comfortable to you? And to me, this is also savable.
Right.
Put in a feeding tube, but we don't do that here. Hospice doesn't do that.
Yeah. They don't. They
Uh,
don't try to.
and
They
then
don't
I'd
try to prolong it. Yeah.
and I'd look at Sheldon and I'd be like, "What are you doing?" And he'd be like, "Honey." So like we're if there was a chance, So I had to kind of hear it from him that
Yeah.
even if we brought her home and at this point, does she want to be on a feeding tube? So I was just very angry. I was
Yeah.
very, very angry at hospice. I was very angry I was just very angry in general. And so those two
Understandably.
weeks were very hard. I tried to make it pleasant in there, but it wasn't pleasant in there. And it wasn't a place that I really wanted her to be. Sheldon didn't want her to be there either. But during those 2 weeks, Sheldon and I went 3 times a day. We had to keep them into short visits, for her sake. I tried one time to get her in a wheelchair, and it took three of us to pick her up because she was straight like a board, so stiff like this. She wouldn't bend to sit. And so then I demanded all that off. I wanted all that, her taken off, all of that. Whatever this is to keep her comfortable. She's like a freak. I mean, I would be so upset, angry, and just, I mean, I wouldn't be belligerent, but how does anyone think that and then roommates trifling through her things and stealing her things. And I mean, they can't help it.
Right. Yeah.
They're all out of their heads. But then I'd say, why is she like this? Oh, she had a hard night. I said, what did she do? Oh, she pushed the arm of the lady that was trying to brush her hair. God. Don't brush your hair.
Yeah. Doesn't
Like,
need to be brushed.
leave it. Like, so during those 2 weeks, Sheila, I packed up my entire house. I think Linda T-shirt came over and helped
Yeah.
me. And I said, I can't do this. I can't live like I'm moving. And I remember the last day I had to go and fly home because I'd had these private talks with her, like, Mom, it's okay. Go. She was so, by that point, they had her on a lot of drugs. There was nothing I could say really.
Yeah.
Because I'd say, take her off this. And they'd say, okay, we'll try that. It wasn't
Yeah.
like they
Yeah.
still
She
had to
wasn't on
keep
for
her
another.
orderly.
Yeah.
They had to keep her orderly. Like they'd find her in the middle of the night picking at the wallpaper. Like they had to keep her contained to her bedroom. They, again, understaffed. They have other patients. They can't follow my mom around all day. She was also walking into other people's rooms. I mean, and they don't lock the doors,
Right.
so they still had to keep her tranquilized. And I try to say, Mom, it's okay, but she would not die with me there. And the last day, like my flight was literally that afternoon. Sheldon was bringing me back to the airport, and I had my house all packed up. And I sat with on the bed. I played James Taylor like on repeat of a CD. Just now, I still can't listen to James Taylor now, but I brought in like a boom box with a CD, and I just had it on auto repeat, and I just play it over and over in that room, so she'd hear something,
Familiar. Yeah.
And yeah, and I tried to say, I have to go now, Mom, and and I kind of knew that it'd probably be the last time I saw her, and I was hoping she'd just do it there so I could hold her hand and like comfort or something, be with her. And as I was walking out the door, clear as day, I was walking out of that room, and the tears of my, and she said, Alicia, like I had heard her say if I was 10 years old. And I turned around and she said, I love you so much, honey. Clear as fucking day. And I was like, I love
That
you
was her
too much.
gift.
Like it was
That was the
like
gift.
the all.
That was her gift to you.
And I got home and Sheldon called me about, or I got home. I got back here to Buffy's house where my kids were. How's Nanny? How's Nanny? And, I said, well, not too good. Still didn't know, but I had a good idea just because of how many days she had been without eating and
Yeah.
drinking. And
You can't survive.
she looked, her breathing didn't sound good. She didn't look good. Even in those 2 weeks, it, from the day I visited that first day to the last, she looked kind of not like a person. She didn't look like a person.
No.
So he called me that night I got home and he said, she's gone. So she waited.
For you to go.
Uh-huh.
Yeah. And I think that honestly, that's like, my belief is that people that are dying, and that obviously if you're,
Oh,
if
she
an
fought it.
accident that's
Yeah.
quick, that's a different story. But when you're dying, like I
Right.
really think that's like the one, like they want who's there to be there, and she's probably like,
Sheldon was there. Yeah, she didn't
Alicia,
want me
I
there.
could have done this a week ago if you had just got the hell out of here.
Right. I think so too.
But
Yeah.
I love that she had that moment of clarity to tell you that she
Oh
loved
my
you.
God, it was so
That's
crazy. It was
beautiful.
yeah, it was the first one really in like 2 weeks that she knew,
Yeah, that's
it was
beautiful.
weird. Yeah.
It's
So
sad
that's
as it
really
is.
the end.
It's sad as it is, but I mean that's the last thing you heard your mother say to you. So
Yeah,
that's
it
pretty
was.
beautiful. I love it.
Yeah.
I just have a couple little other things to ask you before we wrap it up.
Yes, ma'am.
Um, okay, what was the other thing? Did you ever have a conversation with Sheldon about why he was not like more forthcoming with you about your mother's condition, or
Yes.
and what did he have to say for himself?
Yeah, she didn't want me to, honey. You know how your mother is. That's what I'd get.
Yeah.
You know
Well,
how she is.
yeah, because I was wondering, and I don't think that you and I had talked about that, and I was wondering if you, because I know I would have been like, what the hell? Why did you keep me in the house?
Yes.
I'm her only child. I could have been
Right.
supportive and whatever, but you know what? He's
He
honoring her
didn't want to
wishes.
betray her.
Yeah,
Right.
God love him. What a good
Yeah.
man. What a good man. Um, Finally, I guess we'll wrap it up with this. What kind of advice would you offer somebody that is either in the situation you're in or maybe heading into the situation that you were in? What kind of things do you think would have been like, what kind of advice would you have wished somebody had given you
Yeah.
earlier on in your mother's, well, I guess when you learn the truth, because I don't know. I mean,
Yeah.
if they didn't want you to know, what were you supposed to do,
Well, I
right?
don't think she wanted to know, first of all,
Yeah, I mean,
either.
who wants to know you've got
Right.
that kind of
Yeah, I don't think
diagnosis?
she accepted it for a long time. So I think, yeah, that was part of it. But I think just involve your children early on, if everybody's a willing participant. But as far as once you're at that place, I guess someone had told me some things. Meet them where they're at, and if they're at a place where they don't want to discuss it, don't discuss it. But don't fight it. Don't fight the battles. Let them sleep in their jeans. Don't change things up in their schedule. Don't correct them. If they say that it's night and it's day, distract, distract, distract.
Yeah,
All the time, distract. Oh, let's go over here. I guess don't belittle too. That's the other thing is like, treat them like they're children. Don't do that. And I went through a period where, Mom, you want to color? Because I didn't know. So I'd bring
right.
coloring books, and she just, it wasn't her thing. Like, she'd try, but she'd be like, I guess I don't want to color. Like, she wasn't mentally not intelligent, right?
Yeah,
So I think talk to them and just let them ramble. I wish now I'd asked her more stories about what she was writing way back in
yes,
that appointment,
yes, yes.
because she was so passionate, and she had so many details about what she was writing, and the construction guys that were flirting with her,
Yeah,
that were remodeling
that's
her
so
house,
funny.
that wasn't happening. But she
Yeah,
was zesty, she was spicy when she talked about those kind of things. And I think in my situation, I needed to say, like, that wasn't happening. But if, and I'm no doctor or therapist, but I'm just saying, like, let them live it.
yeah,
Like,
yeah,
if they're safe and their
yeah.
surroundings are
That's it.
safe,
Yeah,
let them live in their world and be thankful that you're a part of it. If I had spent half the time being resentful and confused and trying to blame alcohol, or trying to blame her just wanting to sabotage my son's third birthday party, because you
right.
wanted to go home and the burgers aren't even like, if I could have enjoyed the time I had a little bit more, I wouldn't be like, Mom's not living with guilt up
You
there
are.
right now.
You are.
It's me now that just wishes anything that I had had the knowledge and the emotional maturity to not roll my eyes and not be like, "You're fine, Mom. No, I can't." You know, and I got better. Don't get me wrong. I got
Yeah,
better but it was a very short window for me to go through all those
right,
changes. I had about 2 years to go from, are you just under the
right.
influence of alcohol, or why just tell her no, she can't go to the bathroom. Like, I had to get to that point in a very short amount of time.
And
So
there's
if I
no
could,
and there's no guide for anybody.
no,
No matter what your situation, you're kind of winging it the best you can.
right,
And if your mom is not being forthcoming with you because she decides that she doesn't want you to know the truth, you
yeah,
know, you gotta lay some of that on her also, because if you had the
yeah,
knowledge ahead of time, you
right,
could have approached it differently. But she didn't give you that
correct,
information. So, considering,
right.
I think you did, the best you could. So, I hope you
And
don't. I
what's
don't feel.
funny is that, Sheldon lost the love of his life. He was lost without her. He never packed up a thing of hers. The house stayed the same. And, I would call him once a week. And after she'd passed, and we had no funeral, I don't think we had no getting together, but, um, because she died when I was here.
I
I
hope
would
you.
have come
I hope
home,
you will.
but
I hope one of these times you come home for a visit, you'll do um, a celebration of her life with her friends, and I think that would be
it
so
would.
beneficial to you, just to be able to hug her friends and hear the stories.
Oh,
And
the hugging of the friends.
yeah,
Yes.
that's
That would
that's a
be.
huge. It makes a huge difference.
And keep in mind, all her friends, because my mom grew up with some very, well, I say my mom grew up. My mom went through her single years with some very strong other single women
Yeah,
that, were like other mothers to me.
right.
Connie Swan and Teresa Hayner, and like so many, Lori Sites. I had a lot of strong women in my life that every weekend we were spent with. And Lois Cooper, they all reached out to me in some fashion,
Yeah.
in cards, hugs. They still post, on things. They send me little notes. Um, there's Elaine, a friend of hers, Elaine sends me pictures from like she came across these photos from I don't know, like 15 years ago. I just found these photos of me and your mom from our Sea Dog days,
Nice.
and she sends them to me. So it, we did
Good.
have that. And I'll tell you who was the biggest advocate of that is my very first summer home that I came after mom died. I was at the camp and my father says, I don't know, I think I said, I still have her in my closet because Sheldon passed 1 year later. Sheldon did. He waited and he died 1 year later.
Wow.
Um, so yeah, and but he died nicely in his bed in
Yeah.
hospice, way different scenario. But my dad, I said, I don't know what to do with her. I really don't. I don't know what to do with my mom. He said, well, your daughter Chloe was coming to camp a week later. He said, have her bring some ashes and we'll do a little ceremony down here. And I said, okay. So I said, Chloe, go into the closet, get some nanny, put it in a baggie, bring her with you. So she did, and I said, Dad, what are we going to do with this? So he goes and he finds this old crab meat plastic container that he had in the shed, and he put holes in it, and he like put her in it, and me and the kids went out in the middle of the pond, and some of her best friends who have camps down there came out onto their porch,
Oh, I love it.
and my stepmother came out on the porch, and me, Dad, Chloe, Jack, and Julia are all treading water, and we took Mom
Oh,
the
you
little crab
swam. You
meat.
swam out.
Oh yeah, we're in the
Oh,
middle of the lake. Then we just
I thought
watched her
maybe you were on a
float.
boat.
No, we watched her float down to the dam until the
Oh,
thing sank.
that's
That's
beautiful.
Dad said I'll have to go out next summer and get that container out of the bottom. He's joking, but I mean that was
Oh,
my dad doing that.
that's sweet. That's sweet.
Yeah,
That's
we
really
just kind
nice.
of watched. We
Yeah.
watched Nanny because Molten Pond was one of her favorite
Yeah. That's
places.
beautiful.
So I did do that, and that was
Nice.
nice too.
Nice.
That was therapeutic. And
Well,
just that moment too of seeing her friends come out on their
yes.
porches watching while we did that,
Yeah.
and
That's
my
beautiful.
stepmom, and
Yeah.
it was
That's
touching to
beautiful.
me.
Yeah. That's
And we got laughs. We laughed while we did
yeah.
it because
And you
Dad would
should.
be
And
like,
you should. Yeah.
"Yeah, yeah,
Yeah. A friend of mine scattered, I think, his dad's ashes, and they blew back at him.
play blue back, yeah,
Yeah.
yeah."
So, I mean, you gotta have a sense of
We
humor. You do.
laughed
Because if
for
you
sure.
crying all the time, it's not. You gotta laugh
Oh
too.
yeah,
But
right.
that's wonderful. Well, Alicia, thank you so
Yes.
much for sharing your story. And
Thank you. I hope it helped
oh,
somebody.
I think it most definitely did. I hope it helped you. I hope it gave you some
It did. It was really nice to just
good.
kind of
Good.
get it
Well,
out.
I thank you so much, and thank you
Yeah.
for everyone who joined us. I know this went, maybe a little longer than normal, but I think it was important to just talk it out.
Like, love, and share her videos too,
Thank
because
you. Yes.
there's more people than just us. And even if you're not interested, it could be a friend of yours, from a relative, a friend of that person's that, wants to hear it firsthand or could be going through it. You can reach out to me. You can reach out to Sheila. Any questions?
Yeah.
Um, you definitely need someone that you can vent to,
I
though,
think.
for
Yeah.
sure, and say, they're driving me crazy, but I love them.
Yes.
Like in your case, and
Yeah.
yours, like your dad
Yeah.
hurt your feelings. And
Yeah.
that's what prompted me to reach out to you because I
Yeah.
was like, oh, I so
I
know
feel that. Right.
you felt that. It hurt you.
Yeah.
And he didn't mean to, but I mean, and that's what made me say, oh my gosh, I so know.
Yeah.
I could
Well,
so relate.
I appreciate you sharing, and I know it's not always
Of
easy to
course.
talk, especially some of the
No,
stuff
it's
that
a
really hits you in the in the heart. But thank you so
hitch in the
much.
feels.
Yeah, hits
Thank
you in
you,
the feels
Sheila.
for sure. I love you so
All
much.
right.
Um,
Love you.
and thank you for joining us, and we'll see you next time.
Thanks.